Hello once again, everyone. Thank you for your time. Thank you for taking part of your day to join us today, this webinar, in which we will discuss the laws, regulation, and processes to follow when it comes to language access. My name is Catherine Adames, currently the Director of Interpreting Operations at Effective. We will start. I see more people joining. Hopefully they won't miss out much of this webinar. Effective communication is critical to make sure that there is understanding, empowering patients and clients, and to provide high quality care and services. A language access plan can help ensure that any staff member is aware of what to do when an individual with limited English proficiency, known in our industry as an LEP, needs help. The plan that we will describe towards the end of this webinar identifies ways that providers of all types of services can assess their programs to make sure people with limited English proficiency have meaningful access to what is offered in their communities and or public and private organizations. But why is it mandatory to offer language services? Let's review some laws and regulations. During this webinar, just a few notes. Nearly 10% of Medicare beneficiaries are individuals that are LEPs. And important to know that entities that receive federal financial assistance, such as Medicare Part A, C, and D, must take reasonable steps to provide access to their programs by people with limited English proficiency. Reliance on unqualified individuals to interpret medical and all other types of information can lead to misunderstanding and can result in devastating outcomes. Which federal laws require the use of interpretation services? To start, under Title VI of the Civil Rights Act and the Executive Order 13166, federal entities must provide interpreter services for LEPs. This includes healthcare organizations that receive federal funding, such as Medicare or Medicaid, known as CHIP. Under Section 1557 of the Affordable Care Act, this has also created protections for medical interpreter services as part of its protection from discrimination on the basis of race, color, or country of origin. Title VI, Executive Order 13166, and Section 1557 have also created requirements for medical translation services, which means that vital written materials must also be offered in other languages. So we have interpreting services, which is verbal, and then we also have mandatory to have written materials translated for the users in any language that they speak. What does the Title VI of the Civil Rights Act of 1964 say? Well, it expresses that no person in the United States shall, on the ground of race, color, or national origin, be excluded from participation in, denied the benefit of, or be subjected to discrimination under any program or activity receiving federal financial assistance. In Executive Order 131, this was signed in August 11th of 2000 by the president at that time. And it has the title or the note of improving access to services for persons with limited English proficiency. The executive order requires federal agencies to examine the services that they provide, that they identify any need for services to those with limited English proficiency, and that they must develop and implement a system to provide LEPs with meaningful access to all of their programs. It is expected that the agency plans and put into effect language access to all individuals. To assist federal agencies in carrying out these responsibilities, the U.S. Department of Justice has issued a policy guidance document by the title of Enforcement of Title VI of the Civil Rights Act of 1964, National Origin Discrimination Against Persons with Limited English Proficiency, known in our industry as the LEP guidance. This guidance sets forth the compliance standards that recipients of federal financial assistance must follow to ensure, once again, that their services and programs are being accessed by anyone who is not able to speak English. And the Affordable Care Act, which was signed in March 23, 2010, this act has three main objectives. The first one is to reform the private insurance market, especially for individuals and small groups that purchase these insurances. Also to expand Medicaid to the working poor with income up to 133% of the federal poverty level. And three, to change the way that medical decisions are made. All objectives mentioned here rely primarily on private choices, not anymore by government regulations, and these are rooted in expectations of rational decision-making shaped by incentives. What should we know about Section 1557? And I encourage everyone listening to read thoroughly when you have the chance about these regulations that have been mentioned here, as well as the laws that have been passed. The first thing we must know is that Section 1557 of the Affordable Care Act went into effect July 18th of 2016 and has a direct impact on the laws surrounding medical language services. Under this new law, any healthcare provider or health insurance company receiving assistance must provide LEP patients with qualified interpreter. In the past, interpreters who identify themselves as bilingual, or people, not necessarily interpreters who said they were bilingual, they were thought to be competent by the Department of Health and Human Services to interpret. Section 1557 is the first change to language services since DHHS issued regulations in 2003. Under this regulation, bilingual minors, adult family members, friends, and also staff are prohibited from interpreting. This also applies for the deaf and hard of hearing. If there is a bilingual staff that has not been trained as an interpreter, they are not to provide services. And in the event that they must, because of training, this should be also part of their job description and duties, and they should be paid accordingly. Section 1557 now requires qualified medical translators to translate all written translations. Like interpreters, professional translators complete similar education, testing, and training program. There is vocabulary that needs to be handled. Also, interpreters and translators must know the laws and regulations that we are describing here. There is something very important that happened towards the Section 5057 last year. And it is that they have proposed rulemaking or changes or more details to be added to this notice or regulation. And the notes that have been requested first is that there is a reinstatement of the scope of Section 5057 that must cover HHS health programs and activities. Also, it clarifies the application of Section 1557 non-discrimination requirements to health insurance issuers that receive federal financial assistance. It also aligns or has requested to align the regulatory requirement with federal court opinions to prohibit discrimination on the basis of sex, including sexual orientation and gender identity. It makes clear that discrimination based on sex includes discrimination based on pregnancy or related condition, including pregnancy termination. It also ensures requirements to prevent and combat discriminations. It requires entities to give staff training on the provision of language assistance services for individuals with limited English proficiency, and effective communication and reasonable modification to policies and procedures for people with disabilities. It also requires covered entities to provide a notice of non-discrimination along with a notice of the availability of language assistance services and auxiliary aids and services. It prohibits discrimination in the use of clinical algorithms to support decision-making in covered health programs and activities. Also, it clarifies that non-discrimination requirements applicable to health programs and activities include those services offered via telehealth, which now has become very famous after COVID, which must be accessible to LEP individuals and individuals with disabilities. It also interprets that Medicare Part B is a federal financial assistance. And lastly, it refines and strengthens the process for raising conscience and religious freedom objections. Now, based on everything that we have heard, what is a language access plan? And this is what companies, healthcare, and now with all these laws and regulations, every company should follow in order to make language accessible for their clients, patients, and so forth. This plan has 5 parts. The first one is assessing the need, and we will detail each of them. The second one is language services. Third, notices. Fourth, training, and lastly, evaluation. What we're seeing on our screen now is the comment section of language access plan. It describes what each point should have under the needs of assessments, under language services, notices, training, and lastly, evaluation. So who should have a language access plan? As said before, organizations that receive federal funds, such as hospitals, health plans, community-based organizations, and others. Also, organizations that have been credited by entities such as Joint Commissions of the National Committee for Quality Assurance. Our webinar focuses more on individuals with limited English proficiency, but there are also plans that have been issued in order for these companies and organizations to provide services for the deaf and hard of hearing that has been legislated by Section 504 and Section 508 of the Amendment to the Rehab Act of 1973, and also Title II and 3 of the Americans with Disability Act of 1990. So in order to evaluate program accessibility, we should have what this figure here shows that are the 4 factors of a language access plan. First, the number or proportions of people with limited English proficiency who are eligible to be served or likely to be encountered in any of the programs that our organization offers. Then we have the frequency in which these individuals will be using the services or programs that we provide. as well as the nature and importance of the program, activity, or service that we provide to our beneficiaries. And lastly, which resources are available to the organization and the cost for language access services. We should assign a language access supervisor. This person is going to have a great responsibility in their shoulders. Part of the responsibility will be overseeing the organization language access plan, also maintaining a database of qualified interpreters and translators, or LSPs, language service providers. As the law says and legislation have been mentioned here, this person or team is also responsible for training the staff on how to utilize language assistance services when serving their customers. Also, they're responsible for coordinating and managing requests for interpretation and translations. They should manage a budget to provide language assistance services. And lastly, but not limited to, regularly assess and improve the language assistance program. When we talk about assessing the need, what are we thinking of? Well, we need to know the number of individuals in our communities who are likely to be LEPs or limited English proficients. In our office or organization, who will be the point of contacts that will come into, once again, contact with these LEP? The levels of interaction of these people with the LEP, and also stakeholder engagement that will allow the LEP and also the users, internal users of the services, to let us know how they feel with the language access that they're being provided. Some examples that we have here of points of contact in our organization: from the front door, our security guard. If we have a call center, that they know that they are able to provide LEPs with language access, reception area, mail, and also in the case of hospitals and healthcare organizations, have access to language in the exam rooms. Language services. What are language services, right? What are the top two types of language services that are being provided? First, interpretation that can be provided over the phone, which is known as OPI, also video remote interpreting, or VRI, OSI, which is on-site interpreting. If it's consecutive, which is when a person speaks and then pauses, allowing the interpreter to render the information, this being done every 2 to 3 sentences. And then simultaneous, which is when an interpreter is speaking on top of a speaker. We see this on hearings and beauty pageants. And then translations as well. It is very important that when an LEP walks into our organization and they need to fill out an application or a form, or they need to read anything, that this is also in their language. So we have interpretation services and we have translation services. What other things can be translated? Consent forms, like consent to treat, release of information, and also consent to immunization. We also have complaint forms that need to be translated, eligibility forms, financial payment policies, financial statements as well, and very important, patient rights and responsibilities, which include the ability that they have to language access services, also intake information forms, patient instructions, and any other communication that your organization may have. As per notices, I'm sure some of you have seen in hospitals what we call I speak cards. I have an example of this that I'll show shortly, as well as patient user notices and taglines. This here is the I Speak card that Effective provides to their clients. If you want to see it closer, you can email me and I can forward it to you. I'll share my email in a few minutes for all of you. But basically, this I Speak card says on the left, in the party's language that they speak a certain language. A first example here is I speak Albanian, then we have I speak Arabic, and it is very useful for the LEP as well as the staff members in the organization. Staff training. It is important that we provide language assistance services, and we must train our staff on why it is important. We must mention the rules, laws, and regulations that our country has towards language access, and also how to effectively and respectfully communicate and interact with LEPs, the organization policies and procedures related to providing language access services, including the availability of interpretation and translation services that is free for all of our consumers. Also, how staff can capture data around consumers' language needs and preferred languages, which is very important for our organization. Also, about procedures to request and work with an interpreter, including when to use an interpreter, what type of translated information is available for our users, and also many organizations include this training as part of their onboarding process, and this is our professional recommendation. During the evaluation, which is under the responsibility of the supervisor of our language access plan, they need to monitor the organization's responses to complaints or suggestions by individuals who are LEPs. They need to keep current with community demographics and the needs by engaging with local public health authorities, school districts, churches or faith communities, refugee settlement agencies, and other local resources. They should also survey the staff for the use of language access, monitor utilization rates of the different types of language access services, conduct surveys of the organization's consumers about their experiences using the services. And for us as an LSP or language service provider, this information is very useful. If you have to, please share. And lastly, organizations need to cooperate with other agencies about their surveys and investigations inside their own organizations. Always keeping HIPAA and patient privacy as a must. So to conclude, we can say that without appropriate interpretation services and translation services, it is very difficult to have effective communication. And also there will be a lower patient satisfaction amongst individuals with limited English proficiency who need interpreters but do not receive them. And among individuals who receive language services, either from interpreters or people who are not trained, and from non-medical specific or specific service type or untrained supported staff. Providing high-quality language access services at each point of contact is a critical component of high-quality care. Working through the steps described under the laws described can help ensure that our organization is well prepared to provide language assistance services and care to individuals with limited English proficiency. Making sure that we develop a language access plan that includes the sections described can provide helpful guidance to the organization as it works to meet the legal requirements and ensure high quality care to their consumers who are LEPs. For the sake of time, you're more than welcome to send us your questions to the email address listed here. You can take a screenshot or you can take a note. Once again, my name is Catherine Adames. email catherine.a@effective.com. Your questions, comments are very much welcomed. And if you have comments on which webinar or which part of language access you would like to learn about, we will be more than glad to also put together and share as a webinar. The resources, cms.gov, DOJ, I Speak cards from Effective, also notices from Effective, and all other resources that you see here on the screen. You can also screenshot it. And if you want to receive this webinar as well, you can email me and our team will be glad to send it over your way. Once again, thank you for your time. Thank you for joining us today. Any questions? Again, please send it to my email, catherine.a@effective.com. Thank you so much for your time today.